and welcome to another episode of the Reader's Lounge, a special series under Quantum Dialogues powered by NGenious Solutions. I'm your host, Kalpesh Vanushali at Quantum Dialogues. This series brings fireside conversations with leaders who are shaping the future of digital and data transformation, like we have Shaukat here today. Uh, Today, I am really thrilled to welcome Shaukat Ali Khan, Executive CDIO at NHS West Yorkshire ICB, a system serving 2.7 million residents and supporting 100,000 plus users across a large care ecosystem. Shaukat's journey spans global roles at Aga Khan University, leadership across multiple countries, plus earlier impact at UNICEF and Novo Nordisk, a unique blend of healthcare, education, and humanitarian experience. Also joining us is Nilesh Mehta, CEO of NGenious Solutions and author of an upcoming book on turning the last mile digital ambition into measurable outcomes. And Shaukat, welcome to the Leaders Lounge. I would like to start off with my first question. Okay, so Shaukat, the first one here goes. You have led digital and data change across healthcare, higher education, and NGOs. What core purpose guides your decisions, and what early inflection point shaped your leadership?
Thank you so much, Kalpash. I think it's an honor to be here, and I'm really happy to join with my distinguished panelist. I think it's my journey has been really blessed because of the opportunities I received in my different time spans of my career. I think within the context of our my current role, I think it's very important to see that what we are doing and why we are doing. As you rightly mentioned in your introduction, that 2.7 million people around the region where we are serving, West Yorkshire Integrated Care Board. I think that's the base for us about what is the impact we are bringing for our patients, and then how we are communicating with on our day-to-day things. So my core purpose is to enable equitable data-driven transformation that improves lives. As I mentioned, these 2.7 million patients, and then this can be replicated in other regions as well, especially for the underserved populations, as West Yorkshire is one of those underserved populations within the UK context. Across sectors, I have seen how digital and data either widen or close gaps in access and outcomes, and then this we have been discussing, and this goes to trust as well. At West Yorkshire, where I am, as I mentioned, we are in the west part of where we have 5 districts, includes Leeds, Wakefield, Ketterdale, Kirklees, and Bradford. This purpose translates into designing systems that serve diverse communities, reduce health inequalities, and empower clinicians with actionable insights. I think those are very important things within the context of our West Yorkshire, and this is aligned with our national agenda from National Health Services England and from the government point of view. An early inflation, as you mentioned, point was leading a sector digital inclusion initiative as part of our development of a digital and data strategy across West Yorkshire, where we brought together actually different segments of our citizens that consist of over 100 sessions or individual sessions or and working sessions from local bodies, from our trust foundations, from our local authorities, different segment of societies, which taught me the power of co-production. When we do these type of things, what is the power of co-production, and how aligning digital strategy with community voice can unlock sustainable change, because it gives the ownership to all those members who have been part of this entire journey, and that experience shaped my leadership style. And every time when I do these collective co-production strategic workshops or strategic discussions or a journey, it brings a lot of value into how I want to lead, what is relevant for my stakeholders, in this case our citizens, our patients, and then how best we can serve them based on their expectations. So I think this there are multiple examples, but this was one of the examples which gave me a lot of insights on the expectations, on how what we are doing, what is going right at the moment, where are the gaps, how we can do. Because during the discussions we also evaluated and identified the proposed solutions for the future. And I think the style is collaborative, purpose led, and grounded in real world impact. I think that's really really important for me.
That's a beautiful thing to hear, Shaukat. Your answer, the one thing that I could find is every time you brought up a point, it came from a place of helping the people, helping the community, the nation as a whole. So your purpose, at the end of the day, I can see is your purpose, and healthcare as it is, the purpose has always been to help people, and that's what your answers show. Your experience and the helping of people is what you have been trying to do, regardless of what area you were kind of working on. Nilesh, would you like to add something here?
No, again, coming from, having done many healthcare solutions over the last 20 years, I can understand where he's coming from. I guess my question was, I understand you one of your biggest thing was the outreach programs that you've done in coordination with other different departments over there. Any suggestions, guidance on what kind of technologies did you use or leverage as an organization to coordinate this event management, right? Because you're doing multiple events, you said, across these departments. How did you leverage technology to make these events more successful, to get to the community in general and make sure they're able to join and take benefits of these events there?
Yeah, thank you, Nilesh. I think we all understand that now. It's everyone is heavily dependent on technology, right? Whether it's a communication, whether it's a collaboration, engagement, and anything. So of course, Teams was the most important driver here, where we connected everyone, and then of course we were using our project tools to define those things into different projects and initiatives. And at the same time, all these discussions were about technologies, right? Because
Sure.
what we were discussing with our colleagues is that, okay, we are using the electronic patient records, right? How we are doing with that? Are we flowing the data? Is the entire documentation around that, the entire expectations on what we are looking for, is it there? Are we connecting all the different regions into this flow of data? Where are the gaps where we can see patient data? Is the data flowing is expected as standards are saying? And what are the information security gaps within that? What would be the challenges within the information security part of it? So what we were discussing is around technology. And then of course, when we were discussing about technology, then also about the digital workforce. Are we have the capacity? Do we have the capacity? Are we capable
Yep.
enough? Do we have the right trainings and skill? Are we having the right skills to cope with all these new technologies what we are designing towards? And then what are the challenges around it? What are the risks around that? Of course, within NHS, as you might know, that we are running at the moment a very big restructuring program. What is the impact of that into what we want to achieve here?
Absolutely. Again, budget and compliance are always a concern too, right? You have to do these
Yeah,
things
exactly.
within budget and then within compliance, and try to hit certain things in the number of timeline. Like, we have a target for the year and we have to make these achievements and successful over there, right? And great thought process, beyond what we said. Again, I would also think that scheduling and identifying the training, the topics of discussion, the problems that you're facing is one challenge. The other challenge is the logistics of setting up these events, right? For example, in our world, we work with other customers. You generally end up using some kind of a marketing tool or a tool that's an event management tool perspective, because you do want to set up logistics. Where are we having these meetings? How many people can be accommodated in there? Who is a speaker? Are we booking a room in a hotel? Are we booking a conference room? Making sure the logistics are placed. There's a lot of event management that happens, and that's where also a lot of technology comes into place. Sometimes you have just online sessions like the one we are having right now, And it's okay, then you don't need to worry about logistics. You're just setting up a meeting and you get 50 people and you start talking about things. But when you have in-person events happening, when you are trying to bring both your team and the community together, then there's a registration process, there's a speaker process, and a lot of collaboration that needs to happen from that area also. And technology definitely plays a big part over there also. But thank you. That's great insight. Appreciate
Yeah.
that.
And just to add what you said, one of the major outcomes from all these sessions, and which we have launched, right, and you'd be happy that we have started the West Yorkshire Digital Data and Technology and AI Literacy Program now, and this is to engage in, and what this literacy program is to give digital literacy to citizens, to our colleagues, because we have around 2,500 digital data and technology colleagues around the system here. And then to start a digital ambassador program to engage young kids, right, from the university, from the schools, so that they can be our ambassadors. And then within our context of West Yorkshire, then we have started the distinguished lecture series program, where we are bringing inspiring speakers who can connect with our digital data and technology specialists or leaders across the region, so that they can get more inspiration. Our next event is on 22nd of September, for example, where we have invited the inventor of internet, Wensurf, to come
That's
and speak to
awesome.
us. We have developed an integrated care board development program, because what we are doing from the technology is also equally important to educate our board and then get them on board, because at the end of the day, they are going to support us, they are going to help us. And then the two important elements out of this is, one is AI literacy. What is actually artificial intelligence? What are the do's and don'ts of artificial intelligence for our GPs, for our staff here? And then with all these different type of technologies, what is the cyber security threats we are facing, and how we need to prepare ourselves? So our this digital data and technology AI literacy program is around all these different factors, to educate our citizens, to empower and educate our staff, and then take our management together with us.
And one last thing I'll add is, because you are talking about a huge population over here, both including your staff and the community, you're talking about people across a different, variety of age factor also over here, right? The next generation understands AI like this. People like you and me, we are still coping up with. And then we have the senior citizens who will really be having some time challenge in grasping the concepts over here. So being able to cater to all of these different types of audience is also a big challenge, making sure any new technology we bring to the table, can it support all of this and also be future forward thinking, so it will support the next generation going forward for the next 10, 20, 40 years, basically, right? That's the approach I'm assuming you're taking over there, right? Great thought process. It brings one small, because you are healthcare, I'll say it brings one small slogan I saw at one of the local physician's office when I went there. If you're coming to see me for my first visit, my charge is X dollars. If you've gone and done your analysis with AI and Google, my charge is X plus $100. So I need to figure out how AI comes into that picture over there from that perspective, right?
Yeah, absolutely. It's now everything is gradually dependent on AI, whether it's a diagnosis, whether it's a efficiency, whether it's actually the operational management. Every single part, there is some element of AI which is required.
Do you see as a concern if I, as a patient, did my own personal analysis using AI, saying, I got fever, I got this, I come to the doctor and say, I think I have pneumonia. What do you think? How does how does a healthcare system react to that when AI comes into picture, where patients come in self-diagnosed, I guess, in some ways?
Yeah. So I think there are a couple of things which are very important, and that's why I mentioned do's and don'ts of AI, right? And of course, it's maturing. A lot of areas it's already matured, but I think where we need to use AI is to increase and expand the access of these type of diagnoses. I think it's really helpful if far from areas where there are no facilities available. If some sort of easy AI can be used
Yep.
to get some sort of initial screening, right? Initial indication of that part. But I think where we are at the moment is that yes, we can do a lot of those things based on AI, but still I think it's very important to have the actual clinical professionals to
Absolutely.
verify that that's the case. And I think gradually our journey looks like we will be more and more dependent on AI, on diagnosis point of view, on treatment, on actually to relieve from the UK context, to reducing the queues on the GP appointments, on discharge, creating discharge summaries and all those type of things, to have a doctor assistants, right? All those type of different use cases we are working, and you will be hearing more and more and more about all these things.
I agree. I think it's almost like customer service. When you're on call with an automated system, you have a typical span of 15 to 30 seconds where you hear and are patient with what the responses are coming back. At 30 seconds, if you have not seen the answer you're looking for, you want to be connected to a physical, like a human being, and talk to that person. Same concept, I would think, assume, in the medical field over here. If you have a headache, if you have fever, I should be able to answer your question with AI in the first 15 seconds. Beyond that, you have a problem and you still think there's a problem, then you should be connected to somebody in the medical professional immediately, because you don't know what you're going through at that point then.
Yeah, I, especially in this use case, we have implemented uh, together with our third-party systems an AI enabled tooling, which which is capable of doing exactly what you just mentioned: initial analysis, and then directing to the relevant departments or person if required. And that is advancing actually in a rapid pace.
Absolutely. Absolutely. Thank you. KB, next question.
Okay, so we've actually covered a lot of what I wanted to ask again. What I would like to still ask is, when using AI, so AI is actually contributing a lot quicker than expected, especially in a few areas like differential diagnosis. That's something that is helping doctors. If you have seen. Um, but at the end of it, what I would like to ask is, when you are using AI, it's going to give you answers just as good as it knows, right? It's going to refer to available information, and then algorithms are in place for it to decide what comes first. That is again learning from experience of others, but not in all cases it's going to work. So when we are using AI, if you are using analytics from AI, um, you know what actually would work to maintain the trust, transparency, and governance balance?
As you rightly mentioned, that AI can provide what it knows, right? And that's where it's very important to have uh, the evaluation of that part, especially the critical thinking so where we can use AI. There are many areas, right, where this can help us. For example, pathway first design, where early cancer detections or urgent care triage and co-design AI tools with frontline teams, right? They can give a lot of those type of things. Now we are in a lot of these pathology, for example, all the lab tests and everything, right? The AI can indicate where this is going. In the radiology, after looking images, right? AI can help in indicating an additional value towards the diagnosis. So a lot of those, but of course, what is important is that some sort of governance around these things. Within the West Yorkshire, we have the AI steering group, which consists of our clinicians and technical digital colleagues, non-digital colleagues, and then from the legal and ethicists who are there to support us in actually identifying the use cases, identifying the challenges, and then providing the pathways on the direction on whether we should be doing A or B. We also use the same AI steering group for actually bringing best practices from the region, from the national to our context within West Yorkshire. If something is applicable, if something is already happening in the region or national, then we have our members within our group are from national colleagues, from regional colleagues. Then they introduce us with those things, and then we leverage the experience. Same goes if something we are doing from the region, which can be equally relevant for region or national, then they take that. So that's how we are doing. I think the entire AI journey is with collaboration, with a partnership. So we at West Yorkshire, we are as you can see, we are a partner of around 25 institutions across West Yorkshire. We are also regularly working with academic institutions. We have 7 universities within our regions. We are closely working with them about what they are thinking, and then how we can support with them. We are working with our NHS Trust foundations with regards to all the patient data and all the patient care point of view. We West Yorkshire is also one of the epic center for medtech in the UK. 22% of the medtech jobs are within our center. So that means we have a lot of industrial companies within our region. So we work with the industry on a regular basis. The reason of having all these engagements within this context is to learn from each other, to make this relevant to our context, right? And then to go towards more and more accuracy in our outcomes. I think that's where we are. And then of course the transparent evaluation, which is equally important, that how we are evaluating, and especially when we are talking about the responsible or ethical AI part, the evaluation part comes really important. And within our different governance bodies, just to be sure about the inclusivity, we have included different segment of society as part of our board members, so they bring a different aspects of requirements, and then they see from a different lens towards these solutions. And I think that ensures the inclusivity of how we want to approach these things. And as I mentioned in my answer to my previous question, when we were doing the entire discovery for our digital strategy, at that time also we engaged different segments of our society to make sure that we have an inclusive view on the expectations and the projected outcomes and the solutions for our system.
I'd like to pose another question. Now, when we are talking about technology, AI, so there's just a lot of it out there, right? So we need to understand, what's your playbook? So when you are deciding whether to simplify, retire, replace, or integrate, how do you avoid creating new silos, when you are adding new cloud or SaaS services?
Yeah. I think it's a very important question, and very relevant to any of the industries, including ourselves. So what we do is we one of my approach has been that we maintain a live inventory of a system across trusts and ICS partners, to have some sort of visibility on our all part, identifying duplication or legacy risks, and some sort of risk metrics, and then some sort of overall inventory of all the systems, so that we know that what we have as is state and where we want to go. And equally important is clinical and operational input through these engagements, as I mentioned, that we adopt, whether it's a cloud or SaaS, where it improve agility, security, but always ensure interoperability with existing systems, right? All these things, whether it's an integration part of it, whether it's an engagement part of it with clinicians, whether it's a change management part of it, I think they are all connected to each other. That decisions to retire or leave platform are made with the frontline teams who are actually working on that, to avoid disruptions and to understand the consequences of, if there are any, right? And equally important is API first architecture, that which is an open standard, and open standard in a way that it aligns with the NHS framework of target architecture. And also one of the important part, not only in implementation but also in replacement, is the change management. Change management is a very important one that we should be, and we are actually investing in training, communication, and support to ensure adoption and avoid shadow ITs, because AI actually gives this opportunity that you and I or anyone around us, that they can just start their own techno, because now they can talk to chat GPT and then get solutions, right? So I think how we can embrace those things, how we can train our users that where they can do, what they can do, where they need to be cautious, because in all this what we are doing, it's very important to understand the overall vulnerabilities they are bringing to the system. And if we are not secure by design in our architecture or in our infrastructure, these may lead to a disastrous situation for us and our users. So I think cybersecurity, information security, and then overall awareness of how these things work and what are the limitations. For example, I'm from NHS, so we are dealing with patient data. And then how important to be cautious in dealing with patient data, because all the patients, they trust us, and and it's our responsibility and it's our mandate to be very sure that whatever we do, it's in align with our overall standards and align with the patient centric and patient safety protocols.
I'd like
Thanks,
to give
Shaukat.
some
Yeah.
insight on that, if you don't mind. These are some very valid points you bring, Shaukat. Again, having been doing this for 20 years now, this is an age-old problem where you always want to empower end users, but you still want to build your governance around it so you can sustain and scale and keep it secure. Your data privacy at the end of the day becomes the most important part of this stuff, right? We want to make sure end users can get the solutions faster and they can do a lot of it on their own. They just have to understand there's a boundary and all it. That's pretty much about it, right? And then, talking about building solutions in the cloud with SaaS and stuff like that, over the last 20 years, we've seen these technologies grow so much that they solve a lot of good problems for us. But, my thoughts and beliefs are from the point that any platform you take nowadays, right, and you talk about any big game player you have out there, gives you 65% ROI out of the box. You plug in, you start using their systems, you get 65% ROI day one. It is our jobs in technology people to say, how can I get these technologies from a 65% ROI to a 75, 80, 85, 90% ROI? And there are a couple of different ways to do that. Running in silos is good, but when you connect the systems together, is one of the other ways where you can increase your ROI from these platforms, right? And that's one of the things I always look at, in terms of implementations. You also spoke about operational efficiency, right? This is something that we use a lot of something called a technology called ServiceNow, where most customers are looking at it from an operations management point of view, making sure they have the right software, hardware assets defined, monitoring them, making sure they're up to speed, all that technical debt out there that needs to be upgraded into modern systems, because that is really a sword hanging on your head over there. It's legacy systems. While they've served their purpose for the last 10, 20 years, it's definitely time to move forward with technology because our needs have changed, and we have to look at it from a futuristic perspective over there. So these are I'm sure things that you run into challenges on a day-to-day basis, and you have to think about how do I bring this together? How do I make sure that this is going to be good for the next 10, 20 years without causing any impacts for us? And
Yeah, absolutely. I think what you touched on, they are equally relevant to our operations. And as I mentioned, that security by design is our standard. When we evaluate actually our vendors, then we evaluate through security by design. Security by design is not only giving us secure solutions. This is again their overall ethos of working within their company, how they are designing their solutions. what are their principles, right? A lot of those things are part of this entire thing. And that's where now we are in a world, if we can engage with the right people, the right partners, strategic partners, whether it's industry partners or whether it's academic partners, right? It's very important to work together to bring things on the table and then challenge each other about the right way of doing things, right? And I think we as NHS, we learn within our system, within NHS, we learn from outside our industry partners, companies like yourselves and others, and then we work closely with academic institutions to see what they have to offer, and then how we can engage with our young talented teams in getting these to the next level.
Yeah, with the advent of technology in the last 2 decades, with smartphones and all this technology and the internet availability, right? Our expectations from our field force, our workforce is anytime, anywhere, any device, just make sure it's secure. That's it. That's all, right? Because people are used to, buying things from their phone in 10 seconds, 15 seconds. You go online, you do stuff, you're working, you're doing remote technology support stuff over there. I just need to make sure that whatever device I'm connecting with is going to be secure from wherever I am at that point then. So security always first approach, right? Always.
Yeah, absolutely, absolutely, and that's exactly what we are doing, and then security on multiple layers, right? Security from the design point of view, security from the infrastructure point of view, security from the engagement point of view, and security from the awareness point of view.
Exactly.
Because yes, we can do everything. We have the right tools, the right infrastructure, everything. But if users don't know their
There you go.
limitations, then I think we are up for failure, right? So it's a joint venture with everybody
Absolutely.
together, and security is also another area where one institution cannot fight against alone, right? It needs collaboration. It needs the expertise and experience from across the board on how to deal with this area, because as much as we are using all these digital tools and digitalization in general, and now AI in general, I think the vulnerabilities are going in the equal speed.
Absolutely. Absolutely. They're always faster than we are.
So Nilesh Mehta, being the CEO of NGenious Solutions and also the author of an upcoming book titled Reinventing IT Operations, I would want him to pose you a couple of questions around that area. Nilesh, you can take it from
Thank
here.
you so much. I had two specific questions. Shaukat, you had a long career behind you at this point and across different organizations over there. As you moved from one to another organizations, what has been your common themes of? I have always seen this problem in every organization, whether it's employee productivity, it's business process automations, or business intelligence solutions, gathering, making sure the data is done properly. What has been your common theme saying, I've seen this problem everywhere I go and I need to fix this everywhere I go?
Yeah, yeah. One is, of course, the the pressures on budgets on doing all these things. It's common in any company you are going. You will always find that, oh, we have to be very optimized in our budgets, and this we just need to be realistic. That's one part. The other part is the change management part of it, the how you are engaging with the people, right? You can invest millions and millions, right? If you don't have the right ownership, the engagement, the inclusivity with your people, you are not successful. So what I do is that, and this is something I have been doing in the last couple of roles. I go and do some sort of survey on what we have in the tech. For example, yes, I'm with NHS. So what type of technologies we have, and what is the usage of those technological tools, right? What is the, as I mentioned, the inventory of that? If I have an ERP, a state-of-the-art ERP, and if we are not using it, and then we are saying, no, we need this and that and
Yep.
X, Y, Z, then it does not make any sense. What is important is that what are the different tools you already have within your system, and what is the usage of that tool? Do we have the
Yep.
awareness? Do we have the return or investment, or do we have the benefit and realization of those things, right? If
Absolutely.
we have done that, then of course that gives us the next steps on the improvements. If we haven't done that, then I think we are not doing what we are supposed to do. And then the second part, which is equally important, is that with all these different type of investments, I think we do these trainings once when we are implementing, right? What is important is that a continuous journey of training, because your colleagues can move to different roles, new people come in, the culture changes, right? But the training should be there, because everyone should have the opportunity to learn what you have, and then how best they can utilize, and then some sort of championing those tools which are existing there, right? On show, because your users will only attract to use if they see benefit, right? And how they see benefit is that they see benefit through other colleagues within the institution, that yeah, they are achieving this, so let's achieve this, right? So I think these are equally important. And then my last is that we need to celebrate small milestones. It's very important to appreciate, to work with our people. And then if somebody is bringing an initiative which brings value, I think we need to recognize, we need to appreciate those things.
Absolutely. Great points. I think in short, if I were to say in one sentence, marketing, marketing, not just to the outside world, but within your organization is also very, very important, right? You can, like you said, you can bring in the best technologies, but if people don't adopt it or don't see the value in it on why should I use this, then it's not going to work out. So we have to constantly keep showing them the benefits of why the organization decided to bring in this technology. How is it going to affect your day-to-day jobs? How is it going to make you become more productive or bring in better solutions for your customers and increase that ROI? That marketing has to be constant in place. I completely agree with you. Great point over there. My second question is going to be being in the CDIO position, right? If you had top 3 desires in terms of technology, or let's say partners you choose to build, where do you see that gap? Like, you always wake up and saying, I wish I had this today, whether in this technology or in this attitude with my team or this vendor thought process. What would be your top 3 desires in making a much more efficient organization technically there?
Yeah. I think their top 3 desires is a trustworthy AI partner. Trustworthy AI partner, right? Because that's very important. I receive calls from every day, dozens of calls on AI, like, but I think the trustworthy AI partner is important, right? Security by design architecture, right? And then the right people to execute these ones. I think this has been my of course I do have these things at the moment. I don't have everything, but this is what I'm striving, and this is what I'm appreciating in my current system as.
That's awesome. That's great to hear. Great words of insight. Thank you so much. Those were my only 2 questions for today. KB, back to you.
Shaukat, I would like to move on to the rapid fire round now. I'm going to pose 5 questions to you, and let's just hear what comes to your mind first. The most impactful digital health opportunity in the next 12 months?
AI.
One leadership habit you never skip?
Listening.
That's awesome.
Okay. Biggest myth about AI in healthcare?
It can solve all problems.
Your go-to way to recharge after a major go live?
Appreciating and reflecting with colleagues.
That's great. One word that sums up your technology philosophy?
Learning.
Great insight. There's not enough of it.
Yes. One final question from me. One mindset shift every health system leader should make this year to turn digital ambition into real world outcomes?
Yeah, what's important for us as a leaders is that we need to learn, realize, reflect, and then engage. right? It's very, very important that there's so much happening around us. It does not mean that everything is relevant to us. It does not mean that sometimes we are sensitized with so many things. Yeah, this we are missing, that we are missing. We need to learn everything. We need to reflect on what's happening around. We need to realize the realities of what is required. And then based on that, we need to do the right engagements to get to the point where we can decide that what is the future for us.
Great, Shaukat. One thing I can tell you is you firmly believe in look before you leap, and something that's working for everyone might not be for me. That's an insight that with it comes only with experience. We've all been there. We have taken decisions, let's say herd tendency, and it doesn't work out, and that's when you learn. I can see that, and I can really not appreciate that enough. uh, I think we have done with our questions for today. Shaukat, thank you for a masterclass in systems, scale, digital leadership, balancing speed with safety, modernizing estates without new silos, and turning AI into real world value. Uh, this conversation is a part of Quantum Dialogues powered by NGenious Solutions. We'll be sharing a recording on across all our social media channels and professional communities, so insights could reach other leaders working to translate digital ambition into better outcomes. Nilesh, would you like to say something here?
Thank you again, Shaukat. Amazing insights. Healthcare is obviously one of the most important parts of our life on a day-to-day basis, and anything that you do to make this better for citizens is always appreciated. Keep up the good work, and looking forward to learning and seeing your successes and sharing ideas with you on a regular basis.
Thank you so much. Thank you. It's a pleasure.
Thank you, sir.
Thanks again, Shaukat, and thank you, Nilesh. To our audience, more conversations coming soon on Leaders Lounge of Quantum Dialogues. I'm Kalpesh Vanushali, and signing off for today. See you next time. Thank you,
Thank
everyone.
you. Thanks, everybody.
Thank you.
Thank you.
Bye.
Bye-bye.